Hello, and thank you for joining us today to learn about the Planning for the Next Normal at School Playbook COVID Prevention chapter. We'll briefly walk through a couple of plays from the chapter as well as supporting resources. I'm Flora Daniel, manager at Kaiser Permanente, and I am joined by Alex Mays, co-author of the COVID-19 Prevention chapter. Thank you for joining us today, Alex. Can you share a little bit about your background and experience?
Sure. Hi, Flora. Thank you so much for having me. It's wonderful to be here. So, I'm the Senior National Program Director at Healthy Schools Campaign, which is a national nonprofit that focuses on ensuring all students and staff have the opportunity to learn and work in a healthy school environment. I've been with Healthy Schools Campaign for 11 years and have worked at the intersection of health and education for almost 15 years. And for the last year and a half, my work has really focused on supporting states and school districts in responding to COVID. And a lot of the information shared in this checklist in the playbook on chapter on COVID prevention reflects the best practices that we've learned from this work.
Great. Thank you for that introduction. And before we dive into kind of discussing some specific plays and resources, I want to give a brief overview of the COVID-19 prevention chapter checklist, which includes tips that you can utilize in order to enhance your COVID-19 prevention strategy. So the first play is provide staff and teachers with training opportunities to support COVID-19 prevention within the school building. Take advantage of your staff's expertise in health and wellness to develop your prevention strategy. Engage students' families to help develop and implement your prevention strategy. Work with community partners and agencies to develop and implement your prevention strategy. And lastly, destigmatize COVID-19 to support emotional, mental, and physical health in families and communities. Now, here's a glimpse of what the full playbook checklist looks like on the screen. And Alex, I'd love to hear from you if you could tell us why it's important to discuss COVID safety and prevention as we plan to return to school, and how does the checklist help us do that?
Sure. So, as we think about safely reopening schools and keeping them open, we really have to think about the measures that can be implemented in schools to keep students and staff safe, particularly for individuals who are unable to get vaccinated at this point in time. So, for this chapter, what we really wanted to focus on was how schools can open with health at the center. So, that means that the chapter focuses on strategies that build the capacity of school districts and schools to implement federal, state, and local public health guidance. We really think of this as a companion guide to recommendations from public health experts and hope that it will provide districts and schools with useful information to create school environments that are set up for successful implementation of those more clinical public health guidelines.
Great. And kind of digging into the plays within this chapter, what's a play that you like to highlight and some supporting resources that would help with implementation of that play?
So, one of the most important plays on this checklist, I think, is the one that focuses on providing staff and teachers with training so that they can not only support the school's COVID response, but so that they also feel that they have the support and knowledge really needed to do this work. What we feel is really important and what is highlighted in this checklist is how to go beyond training related to academic instruction and ensure school staff are receiving training on best practices for COVID prevention, how to support students during these challenging times, and really important, how to support their own social and emotional health. So we recognize that this is not what school staff signed up for, but we feel like it's really critical to equip them with this knowledge and skills so that they feel adequately prepared to face the challenges at hand. And it's also really important that schools think about providing that training not just to teachers and administrators, but how to provide the training and engage all individuals that work within the school building and support the school. So schools should consider how to provide training and support to custodial staff, school health providers, bus drivers, cafeteria workers, secretaries, and others as they think about the training that they want to implement around this. So one of the key strategies that we highlight on the checklist is partnering with local public health and community partners to organize training around this work. That could be on COVID transmission and symptoms, the local COVID situation, as well as best practices for really creating a safe and healthy school environment. And we also know students and their families have a great deal of respect and trust in teachers and school staff, and that they can be highly effective messengers when it comes to ensuring families understand the plan that's in place and really feel like their voices are being heard. So we highlight how providing staff with training on how to communicate with students and families during these challenging times will be critical to really supporting a robust family engagement strategy, and also ensuring that school staff really continue to stay connected with students, families, and their caregivers, and are equipped to really support them in this navigating the changing environment. So one important resource that I like to highlight as a part of this, this play is the guidance from the Centers for Disease Control and Prevention on COVID prevention in K-12 schools. This piece is kind of central to this whole play, this whole chapter, the checklist, and it's continuously being updated by CDC and was actually just revised in early July to reflect the continually changing environment around this work.
Well, thank you, Alex. It sounds like there's some really comprehensive resources available through the CDC that's up to date and ready to use, and that the chapter provides, and the specific play provides a strong model for schools to implement to keep everyone informed and engaged and safe. So thank you for walking us through that. Now, if you could highlight a second play and resource from the chapter, which one would it be?
Another one that I really like is how important it is really for schools to take advantage of staff's expertise in health and wellness, and recognizing that there are individuals within the school building and district that have a tremendous amount of expertise in health and wellness and prevention work. So we really encourage schools and districts to identify who these individuals are, how they can help plan and implement a COVID prevention strategy, and really work with them to reopen safely and stay open. So that could include school nurses, school behavioral health providers, custodial staff, health education, PE teachers, just really thinking about those individuals who are in your school that have that key expertise. And so as you're developing your plans related to COVID prevention, invite these individuals to the table. Think about how to leverage their expertise to more effectively communicate with staff and families. And they can really be key resources too in terms of partnering with community organizations and others to support this work. I want to recognize we know not every school has a full-time school nurse or a health education teacher or certified PE teacher. So it's really important to look at who you do have within your building that has health and wellness expertise and include them in the conversations. And so I'll highlight one resource as a part of this play, is that the National Association of School Nurses maintains a fantastic reference page on COVID-19. I encourage you to check out the great resources they have on there. It's a lot of fantastic information, but I think it also does a really nice job of painting a picture of the role that school health professionals can play in COVID response within the school building.
Thank you, Alex. And I know this chapter, of course, is filled with all very important plays and resources. But if you had to select a third play and resource to highlight, can you share what that would be?
I think the third one I would pick is the importance of engaging students, families, and caregivers in this work. And it's just so essential to the successful implementation of a COVID prevention strategy. Students, families, and caregivers need to understand what the new policies and procedures will be, and getting their buy-in for these new plans is just essential to the effective implementation. So that can include inviting families to planning meetings for reopening schools, communicating with families about when to send their child to school, new safety protocols, and how the school is planning to really keep their child safe while school is open. And I think it's also really critical as a part of this to help families understand the programs and services that are or are not going to be available at the school. So for example, will after school programs still be available? What will the school meal programs look like? Will their child have access to health services during the school day? And in the event that any of these services or programs aren't taking place, schools can really play a key role in helping parents connect with additional supports to address those needs that the school might no longer be able to meet or provide. And one resource to really help you do that is from the Children's Defense Fund. They have a great repository of resources for families, which cover everything from accessing services and supports to self-care to educational materials. So if you're looking for good materials to share with families in your community, I encourage you to start there.
Awesome. And thank you, Alex, for walking us through a couple examples of the plays from this chapter and resources, free resources that are available to access to support activating these plays. As we wrap, do you have any final thoughts you'd like to share?
Sure. I guess I would just underscore that there are a lot of opportunities to leverage existing assets and infrastructure to support effective implementation of a COVID prevention strategy. So, really encouraging schools and districts to look at those assets, whether that's existing staff with health and wellness expertise or partnerships in place. There's a lot of work that's going on, and it's important to think about how to build on that. And I think, the pandemic has just shed light on how much schools do every day and how their role is so much more than academics. And we hope that the information in this checklist, in these plays, will really help schools understand that they're not alone and have a lot of existing resources that can be leveraged to do this work.
Absolutely. And thank you for that final thought. And thank you for joining us today and walking us through the COVID-19 chapter. To access the checklist and additional resources, visit the Thriving Schools website using the link that's on the screen. You'll be able to download the checklist and look through the plays as well as supporting resources. Thanks again for joining us today and take care.